Hey guys, it's Dr. Garcia. In our last video, we talked about the four conditions that lead to hormone imbalances. We talked about the two models of looking at hormone imbalances, the replacement model and the functional model. And in that functional model, which is getting to the root cause of the problem, there's four conditions that we want to identify: blood sugar, stress, the gastrointestinal, the gut, and then liver toxicity. So in today's video, we're going to get specific. We're going to kind of dive down deeper into the first condition, which is blood sugar, which is the place to start. It's really the best place to start when you're trying to get your hormones back into balance and get your health back into balance. Okay, so the research is pretty clear in showing that imbalances in your blood sugar, which we'll call like metabolic syndrome or insulin resistance. Hopefully most of you guys have heard of that. If not, these are terms that you want to become familiar with, because it's affecting a huge part of our population. Like literally a third of Americans have metabolic syndrome or insulin resistance, and 1 in 2 or 50% of adults have this condition. And basically what it means is that your insulin isn't working the way that it should work. Okay? So insulin is very important. It allows sugar to go from your blood into your cells so your body can use that for energy and for all the things that we use energy for. And what happens is over time, the receptors that insulin work on become downregulated or desensitized. So you can have a normal amount of insulin, or likely even high levels of insulin, but it's just not working because those insulin receptors are not working as effectively as they should. And again, this is called insulin resistance or metabolic syndrome, and it's a very, very common cause of hormone dysregulation. So now we want to understand, how do you know if you have insulin resistance or metabolic syndrome? Well, there's a couple different signs and a couple different symptoms. Some objective findings are if you have high cholesterol or elevated blood lipids, high triglycerides. If your blood pressure is elevated, that's a sign. If you have increased waist to hip ratio, that's another good sign of insulin resistance. And a couple of subjective symptoms that people typically complain of if they have metabolic syndrome is, number one, they crave sugars. Okay, and they crave sugars even after eating sweets. So if you have that symptom, it's pretty much guaranteed that you have some insulin resistance. Okay. Also, afternoon fatigue or tiredness after a meal, or kind of food coma, is another indication of insulin resistance. Insomnia, anxiety and depression, low blood sugar. So if you skip meals and you get anxious, or if you get irritated or shaky, those are all signs of insulin resistance. And also chronic inflammation and hormone imbalances, which is what we're talking about today. What's the best way to regulate your hormones? And in this specific example, it's getting your blood sugar under control. So now we want to understand how insulin resistance specifically affects our hormones. And what we know is that it affects men and women differently. It actually makes women become more like men and men become more like women. Okay, so if a woman has insulin resistance, it tends to increase testosterone, which tends to promote problems with ovulation. It actually creates what's called PCOS, or polycystic ovarian syndrome, which is it's a very common thing, and it's actually the most common cause of infertility that we see nowadays. It can create facial hair, and it can create like thinning hair and male pattern baldness in women. And then in men, it actually increases estrogen. Okay, so it makes men more like women, and it's very common nowadays. We see a lot of like low T or low testosterone, or what's called male menopause or menopause. And so physiologically, what happens is when you have high insulin, it actually, in men, it increases a hormone called aromatase. And what aromatase does is it actually converts estrogen. It actually creates testosterone and shifts it into estrogen. So you get high estrogen levels, which in men can lead to sexual dysfunction. It can lead to fatigue. It can lead to muscle wasting and increased body fat. And so this is, again, it's a very, very common thing that we see today in practice, and it's something that's very, very important to understand. It's actually something that's pretty simple to get taken care of too, if you know the steps and if you know if you know what to do. So what is the best way to treat insulin resistance? Okay, the first thing that you need to do is you need to get your carbohydrates, your sugars, and the refined carbohydrates under control. And you have to find out how much of these carbohydrates that your body can tolerate. Okay, so that's step number one. Step number two is manage your stress, because if your body's under stress, that actually can create blood sugar imbalances. Step number three is really, really important to get 8 hours of sleep, 7 to 8 hours of restful sleep. Studies have shown that just even one night of insufficient sleep tends to lead to more insulin resistance, and a week of of insufficient sleep significantly creates insulin resistance and can create metabolic syndrome. So sleep is critical. High intensity exercise, really, really important in order to sensitize those insulin receptors, to wake up those insulin receptors. Okay, so it's called high intensity interval training, or HIIT training, which is periods of intense short burst exercise followed by slow, more longer periods of exercise. So it's interval training. Okay, and the final, but often most underappreciated or underlooked reason to get to treat insulin resistance is looking at the environmental toxins, the toxic load on your body. What's been shown is that environmental toxins that we're exposed to just so much more now than ever before, those things are endocrine disruptors. And what that means is they disrupt your endocrine system. And so insulin is part of the endocrine system. And what those toxins have been shown to do is to denature or to change the shape of those insulin receptors, creating insulin resistance. Okay, so those are the steps that we teach people, that we really educate people, make sure that they understand in order to overcome their insulin resistance. Which again, this is the first step to improving your hormone balance. Okay, and in the next videos we'll talk about stress, we'll talk about improving your gut function, and we'll talk about specifically how to improve your detoxification, which can all help to regulate hormones and help people get off hormone replacement therapy or just improve their overall quality of health. Okay. So this is Dr. Paul Garcia. Appreciate you watching the video, and if you have any questions or any feedback, please leave comments below, and we'll make sure to answer your questions as soon as we can.